and welcome to How to Gastro. In today's video, we'll be talking about a very interesting pathology, and that is prediabetes. So let's get started. So what is prediabetes? Prediabetes is a common health condition which affects millions of people worldwide. It occurs when the patient's blood sugar level is higher than normal, but not yet enough for them to be diagnosed with diabetes. So why is this so important? Prediabetes is an indication that can help prevent the patient from going on to develop type 2 diabetes if they don't make some immediate and lasting lifestyle changes. So the most important points that we can take from this definition is that prediabetes is a condition in which the patient's blood sugar level is higher than normal, but not high enough to be considered diabetes yet. This is important because at this stage, if we catch it at this stage, the patient can make some lifestyle changes that can actually go on to prevent the onset of diabetes in the future. So that's why patient education here is the most essential tool in the evolution of this disease. So now that we know what prediabetes is, let's take a closer look at the specifics of the disease. So blood testing. So there are three main blood tests which we can do. The first one is the A1C test, which is the glycated hemoglobin test, and this indicates your average blood sugar level for approximately 3 months. Specifically, the test measures the percentage of blood sugar that is attached to the oxygen-carrying protein in the red blood cells called hemoglobin. So if we look at this little table here on my left bottom of the screen, we see the A1 test here, and we see that normally it's below 5.7%. In patients who suffer from prediabetes, it ranges between 5.7 to 6.4%, and in patients who have diabetes, so that means they passed the prediabetes stage, it's above 6.5%. So the next test that we can use to help us in the diagnosis of prediabetes is the fasting blood sugar test. So this is when a blood sample is taken after the patient fasts for at least 8 hours or overnight. So normally, if we don't have diabetes or prediabetes, the fasting blood sugar test will have a score of 99 milligrams per deciliter or below. If the patient has prediabetes, we are looking at a range from 100 to 125 milligrams per deciliter of blood sugar. And if the patient is actually diabetic, it will be above 126 milligrams per deciliter. And the final test we can do is a glucose tolerance test. So this is also called an oral glucose tolerance test. And here, the blood sample is taken after the patient fasts for at least 8 hours or overnight. Then the patient drinks a sugary solution, and the blood sugar will be measured again after 2 hours. So after a night of fasting, the patient comes in, they drink a sugary solution, and we measure the blood sugar again after that 2-hour period. So normally in a patient who doesn't suffer from prediabetes or diabetes, we will have a blood sugar level of 140 milligrams per deciliter or less. If the patient has prediabetes, we will have a range of 140 to 199 milligrams per deciliter. And if the patient is actually diabetic, we will have a level of 200 milligrams per deciliter or above. So what are some signs and symptoms of prediabetes? So diabetes actually develops very gradually, and when patients are in the prediabetes stage, meaning their blood glucose level is higher than it should be, they may not have symptoms at all. Some patients may, however, notice that they are frequently hungrier than normal, they are losing weight despite eating more, they are thirstier than normal, they have to visit the bathroom more frequently, they are more tired and have blurred vision, and they suffer from fatigue and tiredness. So these are all the signs and symptoms of prediabetes. So what are some risk factors of developing prediabetes? So patients are more likely to develop prediabetes if they've had gestational diabetes or have had a baby that weighs more than 4 kilograms, which is about 9 pounds. If they suffer from polycystic ovarian syndrome or have a history of gestational diabetes, they are African American, Native American, Latino, or a Pacific Islander. They're overweight or obese. They suffer from hypercholesterolemia, which is high levels of cholesterol in the blood. They don't do much physical activity. they consume too much red and processed meat or drink too much sugary beverages, they suffer from sleep apnea or work changing shifts or night shifts. So, how can one go about preventing prediabetes? So, healthy lifestyle habits and practices can help the patient to prevent prediabetes and its progression to type 2 diabetes, even if the diabetes runs in their family. So, the key points to discuss with the patient in disease prevention includes eating more healthy foods, getting more physical activity, shedding some extra kilograms, and controlling their blood pressure and cholesterol levels. So some points to remember in the diagnosis again of prediabetes is that A1C level between 5.7 and 6.4, the fasting blood sugar level from 100 to 125 milligrams per deciliter, the oral glucose tolerance test, which ranges from 140 to 199 milligrams per deciliter, and we can also do the cholesterol check to help us in the diagnosis because usually these patients suffer from hypercholesterolemia. And finally, let's talk about the treatment in prediabetes. So healthy lifestyle choices can help patients' blood sugar levels drop back to normal levels. To prevent prediabetes from progressing into type 2 diabetes, the patient must eat healthy foods, which means choosing foods low in fat and calories and high in fiber. They must be more active, which means increasing their physical activity, losing excess weight, so keeping their weight in a healthy range improves heart health and gives the patient more energy. If the patient is a smoker, they're advised to stop smoking. And we can also prescribe some medications to control glucose levels, such as metformin or insulin. They can also take medications to control their cholesterol levels, such as a statin, or some medications to control their high blood pressure. And that brings us to the end of this video on prediabetes. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And don't forget to turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.